out, and discussions are going to be held with countries to ensure that this is also being implemented at country level. Thank you.
Angela, thank you very much. I'm really sorry that we've gone over time, and 1.5 hour webinars clearly not nearly enough, but it has been fascinating hearing from the 4 agencies how they see the gap from their perspective. I have one question which I really would like to very quickly ask all of the UN agencies on the panel, and that's because it's so critical, I think, to our scaling up of treatment of wasting. And in the gap, there is talk of increasing coverage by 50%, not up to 50%, but by 50%. Now, wasting treatment has historically been underfunded and largely funded through humanitarian programming. So really a question for everyone on the panel today is there a UN vision around resource mobilization to tackle scale up of wasting treatment? And that is for anyone who feels brave enough to tackle that.
I can start. I don't mean I have the full answer to this question, and I will be very brief because I'm mindful that we are well over time. Jeremy, I think the first question that we need to ask ourselves is, what are the financial resources we truly need? And 2, to revisit the model that we have been implementing over the last years. We need to identify first, who are the children who truly need this type of specialized treatment, 1. 2, how much would that cost? 3, how do we engage governments to make sure that national budgets contribute to addressing this issue? And 4, if there is a financial gap, what is the role of the UN agencies, donors, and philanthropy? We do have, of course, a plan to mobilize resources to support the development of roadmaps and the development of technical support to governments. But I don't think that we have a very clear denominator, that is, how much do we truly need? We cannot continue to operate under the assumption that we will need to treat 47 million children at a cost of $140 year in, year out. That is over. So we truly need to take this very seriously, do and develop an investment case, but with a very clear understanding of what are the true needs, and therefore what do we want to raise funds for, so that we don't lose credibility. I think some of our credibility is at stake because we keep asking for financing for RUTF and treatment, and we need to stop that way of thinking.
So Victor, if I could just pursue that. That's a really, really interesting answer, and it's lovely that you set it out in that way. But given that many countries now have what are commonly called common results frameworks, expedited by the Sun movement in many cases, how do you see the country roadmap, the country gap, inserting itself into those common results frameworks or nutrition plans? Are they separate, or are they separate, or are they part of it?
They need to end up being the same thing and part of a holistic vision for the country. The worst thing that we could do is think of the global action plan and the prevention and treatment of wasting as that nutrition program that government is not in charge of. That is the nutrition program that humanitarian agencies, UNICEF, WHO, WFP, and others will implement. That needs to stop. That way of thinking needs to stop. We need to make sure that the prevention, early detection, and treatment of child wasting is part and parcel of a nutrition vision in the country, and it's part and parcel of financial investments. And in that, this community that today gathers around this table, and all those who would like to be with us but are not with us, also need to do some introspection. We have been contributing to perpetuating a vision that wasting is the form of malnutrition that we treat, forget about it, governments, while stunting is the form of malnutrition that you governments prevent. We need to stop that, and we need to bring these agendas together, and this needs to be first and foremost a government responsibility, to which we contribute and support.
Okay, that's very clear. Anyone else want to add a thought to?
Yeah, perhaps I'd like to. Oh, sorry, Francesco, go ahead.
Alison, yes, please.
Just to complement what Victor is saying. Yeah, we're basically having a battle to make sure that we can mainstream the management of wasting in health systems. So this becomes part of universal health coverage. And we see that, you know, these services get very easily deprioritized. And the assessment that both UNICEF and WHO have done during this COVID pandemic is that about half of the countries have basically dropped the ball and, you know, seized the services. You know, we are going to face an enormous increase if we don't act on that. So definitely strengthening those services and making sure that they become a priority, not just in terms of financial investment, but in terms of you know, service prioritization and you know, capacity of the health workers.
Okay, thank you. Thank you, Francesca. It's interesting. Alison, you wanted to say something as well.
Just really briefly, just two things. One is that I think that, you know, of course, it had been the intention pre-COVID to be able to have a real proper launch of the GAP and do some, not just resource mobilization, but the general advocacy and get governments behind it. And it was very sad that that didn't get to occur. But just to complement what Francesca and Victor have said, I think that one problem we are seeing is that there is just very low investment in prevention. And even though that we know it's a cost-effective intervention, as you said, it's much easier, even though it's not easy, but easier to get money for treatment than for prevention. And I don't know when that is going to shift, but I think that that is definitely one of the big commitments that we need to make. I raised it at the Sun Global Gathering. I think that the Sun networks also have a role to play in supporting this gap and moving it forward, because as we said, all forms of malnutrition and the prevention all need to sit together. So I hope that we can do some resource mobilization for prevention and begin to bring down our costs in general.
Okay.
Yeah. Just
Marie, I think I know we're way over.
I think I would like to add, Jeremy.
Oh, okay. Yes, go on.
Jeremy, if I may, just just a point I want to do that for us again, the gap has been important of investments in FAO are going into emergency and social protection, and we know how social protection is expanding in response to the COVID. So the attention ability is something that we can do to leverage on existing resources. So before we have been talking about this context specificity, and it's important to really use a livelihood approach to define the context where the child find himself or herself.
Okay, thank you, Patrizia. Marie, we're way over deadline.
We are.
So I'll let you wrap up.
Yes, we're on Irish time, but I think we've done well. I think we've covered a huge amount here, and I hope this is just the start of a very a big ongoing conversation. A few points. There have been questions pinging in on the chat box, and unfortunately we haven't been able to address them directly. But what we will do is we will collate them and we'll share them with the UN team and just unpick and get some answers. And what, if they're willing, what we can do is post the questions and answers on NNet, on our online forum, so we can share a link. So we've sprung this on you, UN panelists, but if you'd be happy to just maybe address some of the questions offline later on, we can then just post them on NNet. That would be fantastic. Because there's some really interesting ones, and they're covering a full spectrum of issues, some very practical and some more policy related. So that would be great. There was also a question just about what are the front runner countries for the roadmap. So we can liaise with you, UNICEF, and we can easily share those with everyone. I want to say a big thank you to you all for checking in and participating, and a big thanks to the UN panel for making the time, a considerable time and commitment, and such openness and transparency in having this conversation with us. So that is very much appreciated. Thanks to the Eleanor Crook Foundation and the team there who actually supported ENN in developing and delivering on this webinar. So that support is very much appreciated. And indeed to all of our long-standing supporters, to Field Exchange, which started all of this scrutiny off at ENN's side, and without this long-term support, this wouldn't have happened. And we will follow up with a very short evaluation just for you to complete to all participants, and we'll have a short technical brief that just summarises what we shared with you today as a follow-up, and we'll send that to all you participants. So I think that's it. Again, a big thank you, and let's hope this is a number of several conversations, and have a good rest of the morning or evening wherever you are. Thank you.
Thank you, Jeremy, and thank you, Marie, and thank you, everyone.
Goodbye to all.
Thanks,
Bye
Jeremy.
bye.
Thanks, Marie.
Bye-bye.
Bye-bye.
Take care. Bye bye.
Oh.